unless maybe it's already recording.
I'm on mute. I'm saying it's recording, it's recording,
No.
it's recording.
As you all are coming in, you'll notice on the screen that there's a Menti QR code. And if you prefer not to use the QR code, you can also go to menti.com, like it says at the very bottom, join at menti, MENTI.com. And then you'll put that code in. You will need that later on. We're going to use some activities through that, some polls and word clouds and open-ended conversations to aid in our discussion with one another. So that's just there for you to get prepared. It's a little bit easier if you pull that up on a computer screen. I always think it is for typing, but you can also use your phone. I'm sure that most of you have probably used that before, but just in case. So and I know we have some other people coming in, but I'm going to go ahead and get started with the basics so we could just respect time here. Welcome, my name is Lynn Lucas. I am with Children at Risk, and I also lead the Texas PN-3 collaborative work. So very glad that you're here today, and we are excited to get to do some exciting things today. As a reminder, our vision includes the whole child, and that's something that's unique in the state of Texas. So we focus on making sure that children have a strong foundation, equitable access to health and early learning supports in their homes and communities, and that early childhood systems are aligned, coordinated, and well-funded to ensure that young children and their families are healthy. So that's a whole lot there, and it's really important that we're able to engage in all those pieces. Specifically, in the last couple of years, we have focused on serving more than 400,000 additional infants and toddlers by 2026. And that's why it's important to have a collaboration, because if you're going to serve that many more children, it takes a lot of us to get that done. There are 3 lead organizations that head up the PN3 collaborative, and we each take a piece of the puzzle to focus in on that. So early care and education, that is Children at Risk. Supported families is Tex Protects, and there's a whole lot in that, which you'll hear more about in a minute. And Healthy Beginnings is led by Texans Care for Children, and there's also a lot in the undergirding of what that means. So today, when we go through the policy priorities, you'll have an opportunity to learn a little bit more about the focus areas of each of those organizations, but also of each of those general focus areas of PN3. Something that I encourage you to do, even if you've heard, there's been a few places where we've talked about these legislative priorities because they are that important. We want to make sure everyone's very clear about what we do. Even if you've heard it before, I encourage you to listen carefully again, because it would be very helpful if, as you hear each person go over these things, if there are pieces of the legislative agenda or pieces of what each organization leads that your organization intersects with, please put that in the chat. And you can just put like the ECI in your organization, or whatever it is that you hear. You don't need to think too much about that, but it will give us an idea of what are our gaps, who else do we need to have at the table, and how many people do we have working tirelessly toward any specific area. So after we go over the legislative priorities, it's going to be the perfect setting for the next step of hearing from Bruno Showers, and you'll David Fegan from Texans Care for Children will introduce him in proper, but we'll hear from the Children's Funding Project so we can learn about some additional funding opportunities for all of these priorities. And that's when we're going to have some activity. So there's going to be some time for us to learn from you. What do you think? What questions do you have? What concerns do you have? Do you want to move forward with things like this? So do take notes of your questions during that time, because there'll be an opportunity for us to dig into that a little bit further. And then, of course, we will wrap up with resources. So to get us kicked off with policy priorities from Tex Protects, I turn it over to Carrie.
Thanks, Lynn. Hey, everybody. I see some familiar faces on here. Happy New Year, y'all. So Carrie Giudice, I'm the Director of Policy and Advocacy at Text Protects. I also just want to quickly introduce my colleague, Brianna Waldock. She is doing her internship with us this session, and we're just going to have some fun. So we're going to kind of tag team this. I think some of you have heard me talk about this, but I'm excited about our agenda. Ultimately, what you're seeing on your screen, we want to make sure that families have the resources they need and they're actually connected to them. So we want to see a full continuum of services and supports for families because we want to keep families together and we want to see them healthy and thriving. So what that looks like, I think several of y'all might remember me talking about how we got an infusion of $65 million last session for prevention services for families. But not every program got that increase in funding. And so that's what we're focused on this session. We want to make sure that fathers and military families see an increase in funding this session. So we'll be advocating for that. What else is in this kind of bucket is about like seeing if we can potentially pursue Medicaid reimbursement for home visiting. Several of you on this call are home visitors, and you guys do great work. And we want to make sure that moving forward, we want to make sure that there is enough funding because only 2% or less than 2% of families that receive these services and would benefit from them actually get them. So we want to make sure that we've got a plan moving forward for that. We also plan to, in this, make sure that we've got plenty of mental health services and supports for families. We'll be advocating for things like that. Also, you guys, I think on this call might be familiar with mental health consultation. We can have consultants come alongside home visitors, early childhood, so ECI services, focus on childcare as well. And so we all know that families are dealing with increased chaos and all of these things going on in their lives and could really use additional supports. And so we want to make sure that those providers have the supports that they need as well as their families, because the families will benefit from that. So those are the things that kind of fit into that category. Again, think of this as the availability of services across the state. Brianna, I'm going to pass it over to you to talk about our next part.
Yeah, so we're focused on making sure families and professionals are connected to the resources that they need, ensuring that people know who to call, where to go to get the supports. Right now, Texas has a lot of different supporters, but everyone is kind of siloed. And so we want to focus on ways that we can streamline services, provide full databases for providers to provide to families whenever they call and are seeking those supports. So specifically in this, we're looking at Help Me Grow. There's 12 Help Me Grow providers in the state. And so seeing what we can do to support them, get more funding there, as well as family resource centers. So there are some across the state, some are accredited and some are not. And so we want to see how can we leverage family resource centers, spread awareness of those, get more resources to those who act as a front door to so many different services to families. And then kind of the third focus under this category is 211. 211 is a referral service offered statewide, but there is some fragmentation between each area information center within 211. And so what are ways that we can streamline the connectors that we have in Texas to better support families?
Thanks, Brianna. And then the last one I'm going to just touch on really touches these first two priorities we just talked about. But I always say, when we're thinking of caregivers, let's also not forget the fact that we have a lot of families and friends of the family that step in and care for kids. I think we would all understand that all caregivers would benefit from the availability of services and making sure they actually get connected to them. But I just want to make sure that we don't forget about those kinship caregivers because they don't have the legal authority to make decisions for the kids in their home when the state doesn't have custody. And so, again, I think they would benefit from the first two things that we've talked about, but we also are looking into ways to make sure that any sort of legal fees that are associated with getting that authority is not a burden for those families. So that is what's in that. I don't know if we're opening up for questions or just passing along to the next, but yeah, those are our three big priorities this session.
if you have any questions, please put those in the chat, and then Kim, maybe you can help us with that. Thank you very much, Carrie and Brianna. Appreciate that. Now we're going to move over to Healthy Beginnings, which incorporates a whole lot. And to talk about that, I'm turning it over to Adriana Kohler from Texans Care for Children.
All right, good morning, everyone. Good to see you all. My name is Adriana. I'm the Policy Director at Texans Care for Children, and I'm here to provide a look at what our Healthy Beginnings legislative agenda is. But I recognize this is a team effort. A lot of you are involved in many of these initiatives, and my team is not here today. They're at the Capitol. They're already working some of these issues as legislative session has started. We're 2-3 days in now. So I'm here to let you know about what we're prioritizing and answer any questions as well. The goal is for Texas to be the best place to have a baby, and raise your infant and toddler. That means that moms and babies and the whole family have to be healthy and get the health care they need. On the maternal health angle, some of the very important ways that we can support maternal health and new moms is through programs that are supported in the budget. So Medicaid, CHIP, Healthy Texas Women, the Family Planning Program, the Maternal Mortality and Review Committee, and Texas AIM, which is a maternal health safety initiative at hospitals. Medicaid covers half of the births in Texas. It also covers half of the children in Texas. So it's a really important driver for health access and health outcomes. At this time, on the state level, we don't see potential cuts. There is steady proposed growth for all of these programs. There is actually an opportunity that I think we have. So there's been an issue over the last several years about backlog in Medicaid and SNAP applications. It all goes through one system. The system's called TIERS. It's an acronym. You don't need to know it. Just it is a system where the application and renewals go through. There are about 200,000 application backlogs. And there's an opportunity this year for the first time in a long time because the agency and lawmakers realize this is getting to a crisis point. And I'm going to put in the chat a one-pager, a sign-on letter on the issue. The agency has asked the state for an exceptional item, which is like a wish list of what they need extra money for. They're asking for over 300 in general revenue state funds, and there'll be a federal match to fix and upgrade and modernize the Medicaid SNAP enrollment system. This is a big deal, and this is much needed. And thank you to all of you, many of you who have signed on. This is a high priority budget item, but as you can tell, it's a big price tag too. So we need as many of you involved to make it into the final budget. We have not seen the actual budget from the House or the state. Sorry if you can hear my little 18-month-old in the background. We have not seen the actual budget bills. They should be coming out next week. So we'll see where we stand and where we need to go, if we're in a good position or not. So second is ensuring that children are enrolled in health coverage and get the health care they need. The first item is connecting eligible kiddos to coverage. There are about 100,000 kiddos who we know are eligible because their families in SNAP and should be and are eligible for Medicaid or CHIP. The bill that we are working, it has been filed, so it's HB 321, SB 238. Let me put, sorry, is that background noise distracting? Okay.
Not to us,
Okay.
just to you.
I know, my heart just can't. I try to tune it out, but it's hard. So we do have a bill in each chamber for this one. It's a refile with some changes, but it would help eligible kiddos get enrolled in Medicaid or CHIP because we know they're eligible from their SNAP coverage. This can make a big difference, and there's bipartisan support. It got through the House last year. We just got to get it through the Senate. I'm excited that I believe we have Senator Perry's support, and he's on the committee as a vice chair. So we, as of now, so you know, we're hopeful. Last but not least, there is a critical need to improve support and funding for the early childhood intervention program. State funding has been chronically low over the past few years. There have been steps in the right direction. An exceptional item from last year was funded. We have another exceptional item this year. It's 18 million. Let me put that material in the chat. My colleague Alec just came out with a brief. So you can use this for your talking points. Again, this is on the wish list for the agency, but we don't know if it's going to get into the budget. It's exceptional item number 5. So it's number 5 on a list of 40. That's pretty good. That's higher priority, but you just never know. And we're in a good place, but you never know until we get the proposed budget bills and we move through session. So we definitely need the 18 million, and we're asked, I think all of you can agree that we need more than the 18 million because of the chronic underfunding. This brief that I put in the chat makes a case for additional per child funding. So please take a look at that. I think these 3 items are doable this year. I feel hopeful, but you're asking me on day 3 of session. You can ask me in May. I might think a little differently, but we need all of your support to make this happen. Happy to
Thank
answer any
you.
questions.
Thank you, Adriana. Love that. So remember to put your questions in the chat, and I'm going to turn it over to Kim, who will talk about early education. Kim, if you would then punt it over to David.
Am I good? Okay, now I'm good. I think there was some muting and unmuting that's happening at the same time. Good morning, everybody. My name is Kim Coffin. I'm the Senior Director of Education here at Children at Risk, taking the early childhood education leg of our 3-legged stool, or our third wheel of our tricycle, if you want to use that analogy. So, you know, thinking and kind of building on that fiscal ask that Adriana was talking about, was, you know, last session, 2 years ago, was the first time that we, as advocates and a community, had asked for additional funding to support early child education. The ARPA dollars were ending. We could see this cliff coming, and we had that big ask, and that big ask is still there. And so this is our second round in that fiscal ask. We've tweaked it a little bit and narrowed it down, and trying to get getting that across the finish line this year, fingers crossed, and if not, continue that drumbeat on that piece. So with that fiscal ask, we have over 90,000 kids on our wait list on our childcare subsidy system. We know we're only serving about 14% of the eligible kids statewide, and so we know we have more children that need care than are accessing care, and that we have funds to access care. And so that first one is really to expand that ask is to really ask for those funds to at least, or ask this right now is to serve 10,000 kids, which is about $100,000 a year, 90,000, 900,000, 900,000, right? Did I say that right, David? I'm getting my zeros mixed up. So asking for that fiscal ask for the expanding that quality on that piece. The other piece is also to really continue to improve our quality. We know that we are now living into mandatory Texas Rising Star programs, where all of our programs that take children with subsidy are on have to be on a Texas Rising Star. We know programs are continuing to work on that piece, but we've got to fix that reimbursement rates to make sure that providers stay in Texas Rising Star. And we know there's a gap when a provider is in a low income area and is actually charging their public parents a lower rate because that's what their parents can afford. And therefore that hurts them, because TWC will only reimburse at that lower rate. And so this piece of legislation is really trying to fix that, to give local workforce boards the opportunity to pay at that full rate based on their quality, not just based on what they're paying their parents. So I'm fixing that piece of legislation there to help increase those reimbursement rates. And they're really thinking about how do we support those families and high targeted needs. We've got some great innovative things happening. Tarrant County's got a great pilot that many of you are aware of that has really supported local communities. And so how can we ask for additional funding to add more pilots and add that more across the state to give more opportunities to really see where those needs are that really local communities can really support those childcare providers to keep costs down for parents, keep wages up for early childhood educators, and really improve their quality across the state. The next piece is our family childcare. We continue to see a decrease in our family childcare. Our childcare centers have bounced back since the pandemic. Many of you know this, but we continue even to this week, we continue to see a decline in our family childcare programs closing down and no one reopening or opening new programs. So this is really thinking about how local municipalities can add additional barriers to setting up a family childcare provider. And so we're trying to limit that piece, that if they're meeting our health and safety requirements through childcare licensing, then that is what's sufficient to be able to open family childcare. And they're really thinking about how to prioritize their early childhood educators. We know there are childcare providers across the state that are have empty classrooms, not because the kids aren't there, but because they can't find a teacher. And we know many of those, unfortunately, many of our educators meet the income eligibility to receive subsidy. So how can we prioritize them as a group to make sure that they can get access to on the wait list, so that way they can reap the benefits of that and also support the child care provider as well. So it will give good high quality care for the kiddos. It will help the educator stay employed and stay with that program, and it will help the providers from being able to reap some of those costs back for those pieces. So that's really the focus that we're thinking about. It's going to be a big ask for the fiscal. Like Adriana said, we're still waiting to hear what those budgets are and where that all falls. When we talk to legislators, we hear that no one's like laughing us out the door. No one is saying, oh, we don't need more money for childcare. The question really becomes, are they going to do it? And where that money is going to come from, and where does it come from? General revenue? Does that come from something else? And so that's really going to kind of lead us into, as we kind of think of all three of these buckets, where does this money come from, and where can the state get those dollars? So I'm going to turn it over to our colleague over at Texans Care for Children, David Fagan, to introduce Bruno.
Thanks, Kim, and good to be with y'all. Yeah, very timely as Kim talks about ways that we can finance all of this important work. I am very excited to bring Bruno Showers to the call today. He is with the Children's Funding Project, and many of you may be familiar with the Children's Funding Project from all of the many different initiatives they've taken on and all the different ways they've helped Texans. Most recently, the Children's Funding Project worked to help advocates and leaders in Travis County with the property tax increase to help pay for childcare initiatives here. And that's what Children's Funding Project really does well, is help advocates in different states figure out financing strategies. And Bruno is really working on that state side. And I have been having conversations with him for a while to figure out what are some ways in which we can identify revenue sources to help us pay for childcare. And Bruno's been a great person to talk to because prior to joining the Children's Funding Project in 2023, he worked at Arkansas Advocates for Children and Families, a neighboring state. So he knows the context well, and he also spent time with the Department of Human Services in Arkansas. So he's worked with states around the country. He's worked with on the public sector side and worked on the advocacy side. So Bruno brings a lot of experience to the call, and I'm excited to let him tell you a little bit more about the Texas context on revenue and some strategies we can consider moving forward. So thank you, Bruno, for being here.
Yeah, appreciate it, David. Gonna share my screen here if I can. Yeah, okay. Second. Okay, hopefully everyone's seeing that. Appreciate the intro, David. I'm glad that you mentioned that I'm from a neighboring state. I'm still fairly new to the national level stuff. I've been at Children's Funding Project for about 2 years now. And so every time I just really enjoy speaking with conservative states. Usually when I talking to other red states, we get in a little bit of a back and forth over which of us is more conservative. I'm not going to do that with you guys today, obviously. But I do think that, you know, a little bit I understand the context that you're in. And so I'm excited today to kind of talk about revenue stuff, why it should be important for PN-3 advocates, and just a little bit more context about where Texas is. So I think the best way to tee up this conversation about like where the revenue is going to come from is to see where the revenue is coming from right now for the things that we're already doing. And so this is Texas's general revenue funds. So there are some funds outside of this. And I also focused on tax collection. So there's other sources of revenue that the state has. But narrowly looking at taxes, this is where you guys are at. I think, obviously, maybe I'm stating the obvious here, but you can see that sales taxes are like the vast majority of the general revenue in your state at the state level. So we're focusing at the state level here. I know property taxes are another big deal, but that's more of a local thing in your context. So a couple of issues with this is that in addition to sales taxes, you guys rely fairly heavily on other excise taxes. So you know, taxes on particular kinds of goods. Like, for example, seeing cigarette and tobacco taxes there, motor fuel taxes. And what that means is that in addition to the fact that it kind of like limits the amount of revenue that you can have by focusing on these sales and excise taxes, it kind of creates this situation, which is that to the extent that we care about the regressivity or progressivity of the tax system, meaning is the money coming from those who have the greatest ability to pay? The reliance on sales taxes really creates this, which is that the lower your income in Texas, the higher your effective tax rate is. And essentially that comes down to the fact that the lower your income is, the greater the share of your budget has to go to buying things, right? The less that you have, the more that is eaten up by necessities. Whereas at the higher level, less of your budget goes towards that. You have more of an ability to save and invest. And so just to say that like our reliance on sales taxes, y'all's reliance on sales taxes is one of the reasons that we have this sort of upside down tax system in which the lowest income Texans are paying like 3 times or more than 2 times the effective tax rate of those in the top 1%, which again, you know, you can only squeeze so much blood from that turnip, right? That's the other issue here, is that a broader based tax system would be able to bring in more revenue for the programs that we know benefit the children and families of Texas. And so in addition to, you know, looking at where the money's coming from, obviously it's worth understanding where the money is going in a broad sense. And so this is like the broad categories of spending for y'all state budget. So we saw where it's coming from, which is largely sales taxes, and this is where it's going. So the things that I would point out here is like, this is fairly typical for a state budget. In the sense that the 2 biggest items here are your health and human services and your public and higher ed, taking up the vast majority of the budget. And obviously, I think those things are all important. But one thing that you probably don't see here, or won't see a big bucket for, is like early care, right? That's because according to our analysis, so we did a fiscal map in your state, kind of looking at where all this money is going to in a more granular level than this. And, you know, if you take out K-12 spending, that's about 90% of the money that's currently going to children and youth in Texas, not including Medicaid, just looking at programs that are specifically for children and youth. K-12 is the vast majority of that state level spending. And that's not to say, obviously, that it's not important. It definitely is. But the proportion that we're spending on early care and education probably needs to go up. I think we all know needs to go up given the great need in the field right now, the great need from families. So that's a kind of broad overview. Right now, Texas is bringing in a lot of revenue from regressive sales and excise taxes. Most of it goes on the children and youth side goes to public education, Medicaid, and Health and Human Services being another huge, hugely important program and spending item for children and families. So, you know, in order to fund new programs, you usually need to find new revenue. And so the different ways to do that are you can create a new state tax, increase an existing tax, or design a appropriation to create a stream of funding. So that last one needs a little bit of explanation. I should have created a slide for this specifically, but an example that I think is super useful for you all. Very recently, the state of Tennessee created a dedicated fund for mental health services for children in their K-12 system. I think it could easily be designed to support early care and education. I mean, the structure of the fund, it could just be directly applied to a different program. But what I think is interesting about it is that instead of finding a dedicated like new revenue stream through taxes, what they did is currently Tennessee has a big surplus. And so they created a fund with a couple $100 million from that surplus, essentially just to generate revenue for this K-12 mental health program that they created. So they have a fund that just generates revenue, and then they created a secondary fund with a smaller amount of revenue that's sort of the operating fund. And so they have a fund that generates revenue to create a ongoing revenue stream for services that is then put into this operating fund that is they are using to put grants out. So it's a competitive grant program. What I think is interesting about that is that it didn't require a new revenue source. So I know in states like ours, very difficult to talk about raising revenue. It pretty much in any context, especially if you're talking about a new tax to do it. And especially, I think we'll maybe talk about a little bit more when the state itself is like sitting on a big surplus. It's a difficult task to talk to policymakers and also the public about why we need to raise new tax money when we're not spending all of what we're taking in now. And so I thought that the Tennessee example was an interesting one for this group. That said, there's still only a limited ability to tap surplus revenues in order to do this. Structurally speaking, the days of huge surpluses are essentially over. The end of federal assistance programs in response to the COVID pandemic, combined with tax cuts that states have pursued over the last few years, means that state general revenues aren't growing as fast as, or state revenue streams aren't growing as fast as they were. That's not to say that Texas is going to be facing a shortfall or anything like that soon, but just to say that the expectation that we're going to have like the biggest surpluses ever, like in Arkansas, for example, we had like 3 years in a row where we had the biggest surplus that the state had ever had. I don't know if Texas ever got to that point, but those days are over. So all that to say that we probably do need to look at actual new revenue streams in order to talk about the investments that we need to make in the systems we're talking about. And so so before we get into the revenue streams or potential tax options that we looked at, I want to give a couple caveats. One, these are very rough estimations. Some of these things we couldn't actually do a real analysis on because the data is just not there. So we had to rely on a lot of assumptions and kind of back of the envelope math. And then the other thing is that these are kind of illustrative examples. I've tried to lay them out in order of least to most likely. but really it's more to give an idea of the amount of revenue that different taxes could generate, just to get you guys thinking about, you know, what's the size of the need in our state and what's a reasonable tax to look at that could actually generate the amount of revenue we need to address that issue. And so starting with the least likely option, the one that I know isn't going to happen, but I think is worth talking about and addressing, is like, you know, Texas could theoretically, knock on wood, whatever, implement a personal income tax. I obviously don't see that happening in the near term. I'm looking at my crystal ball and thinking that this isn't going to happen in 2025. But the reason I give it as an option is one, as I mentioned earlier, the regressivity of Texas current tax structure. This would help address that. Even a flat tax would add to the progressivity of the tax system because of a lack of an income tax, personal income tax in the state. And the other thing I want to point out is that it's a significant revenue raiser, right? Like even a 1 percentage point personal income tax. Again, these are very rough numbers. There's a lot of assumptions built in here about, you know, we would need to make policy design options about standard deductions, various other things. But like you're talking about in the range of, in the neighborhood of $10 billion annually for each 1 percentage point increase in a personal income tax, flat personal income tax, which that's, I think that could probably fund everything that you guys are asking for and then some more, from what I understand. But you know, the reason that you're not asking for all that is probably because we all know that this isn't going to happen. But I did want to say that this is kind of the thing you're leaving on the table, right? Like I know that the lack of a personal income tax is a point of pride with policymakers, probably popular with the public as well. But that means that you're going to have to find other, probably more regressive streams of revenue to fund the things that we know need to be funded. So the other little bit more likely thing that I looked at was a recreational marijuana tax. So these kind of excise taxes are becoming more and more popular for ECE programs. I mean, an example that I think of, it was a different policy, but like sports wagering was tapped in Louisiana. A lot of times when these new things are newly legalized, there's an opportunity for advocates to be one of the program areas, one of the issue areas that get some of the revenue dedicated from that funding stream. And so again, this is a lot of policy design options needed to go into this, a lot of assumptions about sales. I tried to just do like average. And so I think that in the neighborhood of $1 billion annually is probably what you guys could look at or think about from legalized recreational marijuana sales in Texas. Again, I know that this, again, like Magic 8 Ball is telling me that this probably isn't happening in 2025, although, you know, you never know. But another significant source of revenue, although I do want to point out that, you know, two things about it. It is more regressive than a like something like an income tax would be. And then it's also an order of magnitude less revenue, right? Like $1 billion is still a lot, obviously, and could take you a long way towards where you guys want to go. But that probably isn't going to all go to early care, right? Like a lot of that's probably going to go to community reinvestment, to prevention, substance abuse treatment, and various other things, which I think that early care and education would totally be a very justified use of this revenue. But just to say, so those are some of the options here, is that some of this is certainly going to get dedicated elsewhere. It's more aggressive and it's a smaller share of revenue than something like a personal income tax. And then I think probably the most likely here, something that I could see theoretically happening. So for example, a couple of states in our neighborhood are doing this. Louisiana is the only one that comes to mind, although I think a neighbor to your other side also does this, where essentially a lot of states don't have a specific tax on vaping or e-cigarettes, which creates this disparity in how different tobacco products are taxed compared to, say, tobacco cigarettes, essentially, which is the vast majority of tobacco related revenue for states. And so again, a lot of design options. There's different ways that you can tax this, and there's also technically different things to tax within this system. So states tax this in two different ways. You can either do what's called an ad valorem tax, so just a tax on a share of the sales price, like a sales tax, or a specific tax, which is the more popular thing for, say, you know, we don't tax cigarettes based on their sales price. We tax them based on the value per pack. So you can do either of those for vaping or both. Some states have a combination. And then there's different types of vaping systems that are known as like open or closed systems. So just wanted to say that, again, you know, this is a very rough revenue estimates, and a lot of different design options would need to be done before actually enacting a tax like this. But, you know, California raises a similar amount of revenue from tobacco products as Texas. And this is about how much vaping revenue that they raise. And I would say that that's pretty typical for states. So anywhere from like 1% to 5% of the amount of revenue that you raise from your tobacco tax, you can reasonably expect to raise from your vaping or e-cigarette tax, which in Texas, that's anywhere in the neighborhood from, say, $10 million to $50 million. These are annual figures, by the way. And so obviously, you know, vaping is, in addition, you know, less progressive than, say, a personal income tax. And then the other thing here is that, you know, the amount of revenue that you're raising now we're talking about is much smaller, the neighborhood of 10 to 50 million instead of in the billions. And so I just compared these three options here. Quick note, David, as David knows, we did look at other options. So this is just a few I chose to share for the purposes of this presentation, but we're putting together a memo that has like a broader list of things that we looked at that I'm going to share with David. I'm sure David, once it's approved and everything, would be happy to share with you all. So this is the option comparison, just to say that, like, you know, on none of these examples would Texas be standing alone. Plenty of states are doing this. The majority of states, or almost half the states in the cases of recreational marijuana. So there's good examples out there of states you can copy. You wouldn't be having to reinvent the wheel on any of these things. The question really becomes one of political will. It's like, you know, are policymakers willing to do this? Does the public want this to happen? And making the case that it should. And so just a couple more slides before I open it up for questions. I just wanted to show, like, this is a comparison of the revenue sources that I looked at and the Texas's total general revenue. So just showing the scope of what we're talking about. You can't even see the vaping tax there compared to this big bar of total revenue. The only one that really rates is that personal income tax. For every 1 percentage point, you can really start seeing growth in revenue. So the other comparison I wanted to make is some of these options, I think most of these were discussed in the previous two presenters, like policy priorities. If I misconstrued any of these or named them incorrectly, that's on me, not on them. But what I wanted to do was show some of the priorities that you guys are asking for, and the associated price tag from my understanding of the information that's been shared with me. And so these are in biennial terms. So, like, we're talking about needing $115 million in annual revenue to address the current asks that you all have, which, if you look at the revenue sources comparison to what you guys are asking for, I think it becomes a much more reasonable, you know, any one of these almost, other than vape, even vaping would get you a significant amount of the way there, right? Like 40 million annually versus 120 million annually. That's real money in comparison to the priorities that you've laid out. So hopefully this kind of gets folks thinking about revenue. Again, I don't want to say that any of these things are going to happen overnight. And in the general revenues are from surpluses, and kind of making the case that, you know, if you're not willing to do that, then here are some ideas about how we can raise revenue to attach to these new spending programs, if that's your preference. So with that, I will stop sharing and look at the chat, which I totally ignored during that.
Thank you so much for that, Bruno. So Kim, do you want to start now? Go ahead and ask your question that you had about the Tennessee model.
Yeah, so, you know, Bruno, thinking about that Tennessee model, like, that was like, I hadn't thought about that option before. So basically we would take some of our current surplus, put it in a fund, and then pull the interest, leaving the corpus there. and
Yep.
create that fund, correct?
Yeah, it's so I can tell you specifically what they did. So they created one fund with 225 million one-time dollars, and then the second operating fund with 25 million dollars. And basically, they wrote it such that you can't touch the principal on that
Yeah.
big 225 million fund, but that all the interest goes to this second fund, and that's the fund that you can use to do a competitive grant program.
Got it. So how much are they pulling off of that then? So if they invested 250 million, like what does that leave the actual operating costs to do?
So this is their first year of doing that, and I don't know the answer off the top of my head. I can look it up though. I know I can get you an answer.
Okay. Yeah, I hadn't thought about that because like I think that's one of the concerns we hear when we talk about, especially in the early childhood space of, we have a surplus this year. How long will it last? No one knows. In future years. So providing funding for something that may be in 2 years goes away. But if we basically create our own rainy day fund for all things early childhood, thank you. I hadn't thought about that idea before. So now my head's spinning. So just.
We're already excited. It's already been a worthwhile day. Thank you.
So real quick, I have the answer for you now, Kim. I was Googling it. So in the first year, they're expecting to give out 6 million in grants.
Okay.
So, that
it's small.
Yeah.
Still something to think about though.
Yeah. I mean, our ethos at Children's Funding Project is that small is better than zero, right? So
speaking of small, there was a question in the chat about, and I think it might just be how the percentages worked out. The slide that you showed of the different buckets of government expenditure, there was 1% that was left off, so it must have added up to 99%. So there was some curiosity around that 1%.
I think that's just because of rounding. Let me double check.
Curiosity question there. Other questions, feel free to put those in the chat, or feel free to come off and make your comment or state your question, and I will be pulling up some slides for us to engage in some activities with. Yes, David says 6 million in Tennessee is meaningfully more in Texas if you scale it. That's a good point.
Bruno, I had a question. In looking at these revenue sources, one of the things that I think will come up is there's no shortage of good causes that could use additional funding. And so if sports betting got a lot of momentum in Texas, if marijuana got a lot of momentum in Texas, it would be a fierce competition among advocacy organizations, including those that are on a number of different topics. I think when casino gambling, I think, came up, there was an effort to tie that to teacher pay raises, for example. So there's like a number of different. Have any lessons from some other states that have done this about how to engage in that process where there's no shortage of good causes and how to maximize the benefit for early childhood?
Yeah, I know that's a great question. So, I mean, there's like a more cavalier answer to this, which is like, honestly, early childhood in particular is just more politically popular than most of the alternatives. And so like, that's been our theory of change, especially when we go to the voters at the ballot box at the local level, is that's one argument, just to be totally honest with you, is like, if we need to get this over the line, you guys need us. Actually, that's often true. But I think another, to be a good coalition partner and respecting the fact that these other uses, as you said, it's not like they're a waste of money. They're important, and the state should be funding them. I think it's just important to be in partnership and in coalition with these groups. And so like talking to them now on the front end, as we're talking about potentially raising new revenue and making sure that I don't know that it needs to be a formal coalition or anything, but like, yeah, talk to the housing groups, talk to the criminal like justice reform groups, definitely talk to the teachers, you know, and superintendents and all that. I think even at the end of the day, if you guys don't agree and can't come to a consensus on how the funds should be divided, I think having that relationship, having those conversations will still be helpful in both creating a better like end a policy and then managing those relationships and making sure that like, you know, even if we disagreed this time, we can still work together next time, you know, with the understanding that we're probably going to have to take multiple bites at the apple for us all to kind of get where we think we need to go.
Thank you, Bruno. Here's a question I've heard asked, so I'm going to propose it to you. Texas we have a surplus. I don't know how much longer we're going to have a surplus, but we have had a surplus. And so why do we need to consider some of these other funding streams if we have had a surplus?
Yeah, and so, you know, it is the will of the legislature, I think, ultimately. In some states, as I think the Tennessee example is a good one, for instance, policymakers have been willing to use the surplus in order to create new programs. In some states, like in Arkansas, for instance, just the idea was that we can't use one-time money to create an ongoing liability, right? So the idea that because we have a surplus now doesn't mean that we're going to have one in 20 years. The idea being that this program's permanent, it's still going to be around. And so I think that's a justifiable stance. I mean, sometimes policymakers have a different standard for like a tax cut, which is also an ongoing liability. I mean, like double entry bookkeeping would tell you that, you know, an entry on one side is equal on the other. So whether it's increased spending or decreased revenue, that's something that should be not, you know, that should have equal standards around. But at the end of the day, I think it is fair to say that, you know, the surpluses we know are temporary, and we know that the needs of the programs are going to go on in perpetuity. And so even if it's not today or next year or 5 years, at a certain point, we're going to have to look at the revenue that's coming in, and you might as well start that conversation now.
Thank you for that. While I transition over to these other slides, I'm wondering, David, I know I'm putting you on the spot with this. So if you or Kim, there was a question in there about special needs and the wait list. And the question is, why does it take so long for children with special needs, families who have children with special needs, to get help with that funding?
It's a good question, and then probably complicated answer that could give a whole presentation. I mean, I think there's a few things. Children with disabilities are part of the priority group for the Child Care Scholarship Program, which is good. So theoretically, they should be able to get a slot more quickly than others. However, we do know that regardless of where you are in priority, because of the lack of state funding, the wait list is extremely long. And, you know, depending on where you live, it can be 6 months to 2 years. So if there's not a slot available because we aren't funding scholarships, then your place in line isn't necessarily going to help. The other thing is there's just a shortage of slots and programs that are really well equipped to help children with disabilities, and so it limits these options for families. So and there's a number of things, you know, we're trying to do to change that, but I think it's the lack of supply of high quality programs for children with disabilities and the lack of funding for scholarships that leaves all families, including those with disabilities, scrambling and waiting for a subsidy they're eligible for. But it's a longer answer than that, but it's hopefully helpful.
Thank you very much for that, David. Appreciate it. So we have some questions that we'd like to ask you to engage in. And so you will use the code to go to your Menti or go to menti.com so you can participate in these. And they may help us generate some additional questions for our conversation and certainly to gather some information. So let us know something new that you learned from this conversation. How we can increase funding streams. The 90% of the funding for children goes to K through 12. Yep. Tennessee model. Current funding opportunities, potential ways to use a vaping tax or other revenue. Ideas from other states. That we don't have the funding needed to provide the services for those that are in desperate needs. Definitely special needs and homeless called out. I'm glad that the conversation served as an introduction to some additional funding needs. And even if, for some of us, even if you were familiar about the idea in general, getting us some specifics like the Tennessee model is interesting to consider. Medicaid covers half of pregnancies and half of all Texas children. Not enough. Oh, the idea of creating a separate funding stream of early childhood, similar to Tennessee. Yeah. There any, based on those comments or any that you have in your head, any questions or comments that anyone would like to make?
Well, just the personal income tax, and David put in the chat that, a couple years ago, we voted constitutionally not to ever do that.
Okay.
But that really does limit us, right? Like, I mean, don't get me wrong, as a Texan, I love not paying personal income tax. But because of that, we really do limit what we can tap into. And, and I guess a question, Bruno, we know like our sales tax is higher, our property taxes are higher. Does that all even out in the wash, or like compared to other states? Or are we really leaving money? And I know the regressive piece of the, of our sales tax. Okay, I get that piece, but like dollar to dollar, has there been any analysis on that type of stuff?
In terms of like, are you raising less revenue per like capita or whatever versus other
Right.
states that do have a personal income tax? I mean, I'll give you a tentative yes. I mean, there's a lot of factors in there, but the overall
Yeah.
yes, like the fact that you don't have a PIT, it means that you're raising less revenue. Just, yeah, as you said, it just inherently limits your option.
Yeah, because I think that false narrative of, well, we make up for it in sales tax and property tax. But that's also why
Yeah.
people love to live in Texas, because it's cheaper for us to live in Texas.
Yeah.
But we also can't afford to have the services we want for children and families.
Yeah, the way that I would frame that is like, they are higher, right? It is true that sales and property taxes are higher, but it's not higher enough to make up for the difference in revenue from like a personal income tax.
Great, thank you.
That was a great question. I would like to highlight the enthusiastic e-cigarette tax would be a great resource of revenue. 33 states already have a tax. We could successfully push for this. Okay, thank you for that. Here's the next one. Something you have questions or want to know more about. Something I love about Minty is that it's all anonymous, so you don't have to worry about any kind of question or comment or thought that you have here.
Well, I'm going to offer to do some digging on the Tennessee model.
They're having issues on their end. Yeah, I mean, so if I wanted to go in and talk to them.
these are both kind of similar, like next steps for getting an e-cigarette tax passed, or curious about the political strategies to make these happen, how we get the collective members to engage over session for testimony sign-ons. What would it look like to initiate any of these pathways? So a lot of questions around that. Um, is anyone on this call familiar with the HOPES RFA from Texas Health and Human Services?
I was gonna say that whoever typed that, if y'all want to connect, I can put my email in the chat so we can talk offline. I don't know what questions you might have. But yeah, we had pushed that out through our Texas Prevention Network, and we work closely with FSS. So let me put my email in the chat and we can connect.
Thanks,
And
Carrie.
then Cynthia Pearson says, hasn't some cities already used some of their city revenue streams for taxes from taxes? I seem to remember hearing that recently about Austin. Yeah, so Austin just passed a tax rate on their property tax. And it was Travis County actually, so all of Travis County. So yeah, there's that city approach that's definitely part of the play and part of the answer. It's also then what, you know, thinking about how do we potentially do this within local communities, but then how do we do this also statewide?
And just want to mention, Austin is the most recent example. We San Antonio also did this with a sales tax. We helped them there as well.
Right. So many of us are familiar with, you know, pre-K for SA. That happened, gosh,
Yeah.
almost 10 years ago.
Libby.
I just want to say about the Austin thing, which was incredible. We loved the Children's Funding Project for all you helped us with, and all of you on the phone, I'm sure you helped in some way. So thank you. Just in terms of money, we're going to give 75 million. So when you look at some of the figures here, just think about it, that in Travis County, we're going to have 75 million to spend for early childhood. So it's a significant amount of money that can occur. And then we need to make sure during the next legislative session that they don't come in and prevent this from happening in another county. Because if you look overall, there is a deficit on funding early childhood from the local level. It's not as much at the national level. There is a huge amount of deficit, obviously, at the state level in Texas. So thank you all. That was a great presentation.
Appreciate that, Libby. Thank you. So this next one, it's a word wall here. If you will put your answers, these will be one or two word answers, but what excites you the most? Thinking outside the box, funding. Oh yeah, the opportunities, supporting families, opening doors, growing, surplus, partnership, children helping kids, involvement, collective action. Definitely love all of those. Yeah, I think we're ready to think outside the box. You know, it's like you experience what hasn't worked so well, and advocacy, research, the potential, hope. Best word ever, hope. Definitely some excitement there. Any comments or things that I'm missing in the chat before we go to the next one, or as I go to the next one, maybe? Okay, the flip side of this coin is what concerns you the most? not being open-minded, lack of concern. Political climate, it's a challenge. Attitudes and lack of concern. Not having a collective voice, because you have to have a collective voice. The time. Deaths. I'm curious about the death, if that is, I'm concerned if we don't do it, that it will result in death, unhappy, or I'm concerned if we do it, that we're generating something off of, cigarettes. There's kind of those two different ways. So I'm not sure which way that person meant it, but feel free to come off if you want to clarify. Distractions, polarization. So interesting how even just one word can really make you think, The limited capacity. And I wonder if that somebody put time on there, when you think about how are you going to spend your time, and what that means, then there's things you can't spend your time on. Legislative will, getting things passed. doing the good work, that's the hard work. That's what we do. That's what we do. PN-3 Collaborative, that's what we do. Fabulous. There any comments or questions? Thoughts before we move to the next one? We do have a couple more. Hi, Dawn. It's good to see you. Okay, so let us know, what are the big federal issues you're thinking about? Wondering if cuts are coming to Head Start, keeping peace. Oh, yeah. Feels like a tall order sometimes, doesn't it? Changes to Medicaid. Oh, that children's a priority. They're still our future. Why maternal mortality isn't front and center with the incoming administration. Definitely more federal issues that give concern with a significant change in administration. Unity, the workforce. Inability to prioritize the people who need the support the most. Yep. Vitality of the new administration. I hear there's a lot of concern, it sounds like, from us on that one. Just understandable. How the upcoming immigration changes will affect our children and families. Yes. Certainly something we've been thinking about. Shortages of funding and not being a priority for the people. Any comments or questions on this one before I move to the next? So we're curious, what key places do you get your information from?
And Lynn, we're thinking more like not what news channel you listen to or subscribe to, but more like what listservs are you all on that you're getting? So that way, one of the things we've talked about is we are all three of our organizations are on a lot of national listservs and statewide listservs. And are you all on there? Or would it be helpful for us to pass that stuff on to you? So that's kind of what we were thinking on this one. So don't need to know which news station you listen to or which podcast, but if you're on a listserv or something that's specifically topic like CLASP or National Women's Law Center or any of those that you are potentially on.
Forums like this, staffers at the Capitol, the workforce, professionals, and NGO webinar newsletters. Yep. Oh, TLO. I don't know what that is. Kim, do you know what TLO is?
Texas Legislature Online.
Oh, I do know what it is. I do know what it is. I did not recognize the acronym. Thank you. Workforce and childcare forums. Google. Yeah. TLLC Workforce, Texas Health and Human Services website. So there's a lot of looking to people. Looking at a few specific websites and newsletters. Oh, the national listserv. Very helpful. That's very helpful. Emails from different agencies. Emails, TEA, TWC, HHSC. It's helpful. Appreciate that. This next question is, we have this one and one more, I believe. So this question is, what do you need? What do you need in terms of moving things forward when it comes to looking at those different ways of approaching funding sources and having conversations that would continue our legislative priorities, including the funding component? What do you need? Kim, is there anything that you'd add to that what do you need question? What do you think?
No, just thinking about as we approach legislative session and like what would you need to do? Everything from what would you need to do your job easier to what you need to do to help you be more successful as you go to the Capitol. Like either of those two things. Thinking as we as PN-3 collaborative, how do we continue to be a resource for you all? This would help us know what would be helpful versus us just throwing stuff at you. Data in one place, templates, clarity in what the asks are, guidance. Transparency. All right, we got one more, Lynn.
Got one more. So this last one, are you interested in further conversations around using funds from the kinds of things we've talked about today? So just basically, this is a to what degree. You're not interested? Are you not sure if you're interested? Are you interested? So please give us an idea of, you know, how you're feeling about this, as it may guide some of our next steps. Again, we won't know who's interested and who isn't. We're just getting a general kind of aggregated idea from this group as a starting place.
Looks like everybody's interested.
So continue to put your answers in there, because the system is still gathering the input, so we'll have it. I want to get to the last couple of things that we have, so please continue with that. And I'm going to bring back up the very last parts of this other slide. Are you all seeing that slide? You are not seeing that slide. Okay. Now, are you seeing the slide? Okay.
Now we're seeing the slide.
Now you are seeing the slide. Okay, so advocacy and action. Thank you for the conversation and your thoughts around everything that we discussed today. Bruno, thank you very much for being here. We appreciate you taking the time to do some of that research, gather that information, and put it together in a form that could be shared today. Clearly, it was a great conversation. It was beneficial information. So we appreciate you and the Children's Funding Project for doing the work that you do very much. There are two. Guess what? March 6th is going to be a big day at the Capitol. I know every day might be a big day at the Capitol, but March 6th is a particularly important one. Why? Because we have two rallies happening on that day that directly reflect PN-3 policy priorities. One, that's the Texas Prevention Network, that's led by Tex Protects. They'll also be talking about and supporting home visiting. That will be March 6th at the Capitol starting at 9 o'clock. There's a place for you to register. And then after that's over, you can head on over to the ECE Rally Day. That one is led by Children at Risk and Texas AEYC. Starting at 10 o'clock, we'll meet at the South Steps and support funding for childcare. So I encourage you to use that QR code to register for that event.
Lynn, is it okay that I jump in super quick? We are working.
Absolutely.
We're working on updating that QR code. We're going to be probably switching the service we use to register folks so that it's actually easier for folks who register to have all the information they need. So just stay tuned, but at least mark your calendars, pencil it in, because we hope you guys will participate.
Thank you, Carrie. We really do hope that you'll participate. We'd love to see a lot of people there. Kim, anything that you'd like to add to that?
No, just come and mark that on your calendar. We are also planning a couple pre-rally day webinars in mid-February to kind of like prep you on what to expect and kind of go over things. So those we'll send that out information out. You don't have to come to those. But if it's your first time at the Capitol, or it always makes you nervous, we'll just kind of walk through what to expect and the map and like all those kind of logistical things. So just to calm anybody's nerves, but we'll have a great event, and it's always good to make sure that our legislators know that we care about young children. So we'll be there and be strong.
That's right. Thank you, Kim. Appreciate that. Kim, I'm gonna ask you to give a quick coverage of this one as well, if you don't mind.
Oh, yeah. So for those of you that are in early childhood, specifically those of you that are either classroom teachers or you're a director or owner and have classroom teachers, NACCE has their next version of their NACCE ECE workforce survey. They started doing these during the pandemic and do them every so often, kind of getting the pulse of what's happening on the ground in the field. So this is your chance to like share your story. The more we have it from Texas, the more we can use this data to show legislators what is happening in the field. So the link is there. It'll be included in the follow-up email as well. And just spread it far and wide, because if we have a good showing, then we can use it as well. So and it's open to anybody. It's free, obviously. You get entered for a raffle gift card. So so share it with your directors and owners, share it with your staff, etc.
Thank you, Kim. So as Kim alluded to, there will be a follow-up email, so you will get a copy of the slide deck. Bruno, would you be willing to share your slide deck? We can, okay, fabulous. So we'll be able to have all of that to you, as well as the link, so you can easily access that survey. So here are other ways that you can stay up to date if you didn't have that information already. And lastly, we'd just like to thank you all very much for being here, and importantly, all that you do for children.
Thank you all. Have a
Yeah,
good day.
appreciate the opportunity.
Yes, thank you,
Bye,
Bruno.
everyone.
Thank
Appreciate
you.
you.
Bye.